This is Chit Chat That with John and Stefan.
Lime in the coconut and bring it all up. Lime in the coconut and bring 'em all up. Lime in the coconut and bring 'em all up.
Okay, I think that...
I sang that forever at work.
Did you really?
Yep. I have this thing where I can't shut up at work anymore.
I know, I'm sorry. I'm not there to bounce off with the ideas and comments and stuff. It's kind of sad.
Ooh, this is kind of cool. Maybe I'll just read Twitter and we'll just talk about random things I see on Twitter.
That could go forever. Well, take myself a little sippy sip there.
Is it recording now?
It sure is.
All right. Clap.
Like, what kind of clap are we talking about? Like, oh, like
I
an
clap
audience?
Like the ch.
Oh, that's for video.
Ch. Okay.
Like,
Okay.
That's to sync the audio with the video. If you're just doing audio, it's nothing to sync with. So,
Well, let's start with that. So, welcome to Chit Chat That. I'm John,
I'm Stefan.
and we're going to chit chat that. Not really much on the agenda today, so we'll talk about random things, which is kind of what we do anyways.
Yeah.
Like an agenda really does anything for our show. But yeah, I was just reading a New York Times article as you were getting set up, because you set everything up, because obviously with my previous comment, I have no idea how any of this works.
You have a little idea.
A little, more than I did before.
That's right.
So
That's how you get it.
in the trajectory of life, I'm headed up with my knowledge. I'm starting really low, but I'm going the right direction.
There you go. See?
But in 2017, extreme weather events caused a total of $306 billion in damage in the U.S. I would say 2017 has been kind of rough for natural disasters, as you would tell from this article. We've had a couple. We've had Houston, and that was huge because Houston's a pretty big city, and
What happened in
water
Houston?
damages everything. The flood.
There was
Remember?
a flood in Houston? What happened?
There's
When was it? That's how much news I follow.
So it was in the summer, heading into fall.
Okay, so this is a while ago.
Because
See, if anything past a couple weeks, it's gone.
did you hear about the Californian fires?
I did, because I talked about them about a couple weeks ago, not last week, but some person brought it up.
Yeah, and there's some in like the central northwest. If I say every direction,
There's
like the Montana, Dakotas, Wyoming, that kind of area, and there's some in Oregon, Washington, but also California. The fires took away a lot. Recently, there's been the mudslides in California.
because they were saying that was the next worry.
Yeah,
With all the rain that's putting out fires, but now all the mud's going to come down because it killed all the roots and plants and stuff or something.
Mm-hmm.
That normally would have stopped that kind of thing.
See, the crazy thing is we actually need fires for the ecosystem. And when we keep putting out fires, it changes the ecosystem. I remember this in biology classes.
Oh.
But they talk about like fires getting rid of all like the weeds and the grasses,
Yeah.
but it'll leave a lot of the bigger stuff.
Huh.
Some fires take away everything.
They get rid of all the mean weeds that kill the good plants.
Yeah. But yeah. that was it. That was all I had for that.
From the ashes of disaster grow the roses of success.
I've never heard that before.
Really?
Never ever.
Have you ever watched Chitty Chitty Bang Bang?
Yeah, I just don't remember that. That's from Chitty Chitty Bang Bang.
Yeah. So hats off to all you Chitty Chitty Bang Bang fans. That was for all you.
I can only think of dirty stuff when I hear that.
Yeah. Don't. Nowadays, if you said Chitty Chitty Bang Bang, you just who knows? Don't look that up.
No
on
way could
Google.
that be the name of a title or like a name of a movie nowadays.
Well, it could be. It's just not the
Bunch
kind of
of
movie
perverts.
you're thinking.
Yeah.
Not a good old Dick Van Dyke.
And and Dick Van Dyke is in it.
It's just
At least
not
he
getting
has
any
the
better.
appropriate Van in his name, unless you think of creepy vans.
There is a creepy guy that's after kids in that.
Oh, what is
Do you
he?
remember that? The guy with the really
Yes.
long nose. And he's like
He
sniffing
has-
out the kids.
He has a name
It's
though.
creepy. I don't know what his
I
name
remember
is.
doing
But
something.
he was doing
and
candy. He was offering candy. That's how he tricks the kids. He locks them up.
I remember I think I was talking to somebody about like horrible TV
Or
like villains
shows
in
that
movies.
scar you from
Yeah.
your childhood.
And like because he would catch them and like put them in a van or something, or like a truck. Kind of like it's pretty much like a pound.
Oh, what show is this though?
Chitty Chitty Bang Bang
Well, yeah,
Is that right?
it was like in a cage.
in a cage.
Yeah.
That's horrendous.
Yeah, horse and buggy cage.
Because I remember seeing the Princess and the Frog, the Disney one.
Which one? Like the most recent one?
Yeah, the one that was set in New Orleans.
Yeah, that's it. Yeah,
and
the
had
most
like
recent one.
voodoo and these spirits were
I actually
going and
thought that one was
snatching
pretty
things.
good, but anyway.
I remember that being intense. I was watching it with my nieces. Like
Yeah,
me and my wife took them to go see it.
yeah, the voodoo
and-
guy's pretty scary.
Yeah, they were like, during the whole show. that was probably the most recent intense one. But I feel like most shows aren't like that anymore. Like if it's directed towards kids, it's not intense. But if it's directed towards like an intense, it's over the top intense, like Human Centipede, Saw, or stuff like that.
Yeah, those are just
You don't see a good
weird.
mix of things anymore. Everything's
Uh-huh.
like
Yeah.
narrowed to a certain group of people.
That blurred lines is no longer there. It's either intense. Well, I don't know. Actually, there was a thing. I did hear that. No, it's okay. I did hear though that Ninja Turtles, the new one, like the live action Ninja Turtles,
Mhm.
like a lot of people felt like it was too intense for kids, but too stupid for adults.
I did see,
I
like
saw
you're
the
talking about the
first
most
one.
recent one, had
Yeah,
Megan
with-
Fox as
yeah.
April O'Neil.
Mm-hmm.
I feel bad because I feel like we had it perfect growing up as kids. So we're like 29, 30, right?
Mm-hmm.
We had the cool cartoon that was awesome growing
yeah.
up. And then we had like the live action one that was them in actual turtle suits. Like it wasn't CGI at all. It was just them in costumes. And I feel like that was way better than the CGI stuff is now.
I think in a lot of ways it can be that way because in the CGI stuff, you just know it's fake. I mean, the other stuff you know is fake too, but you also know it's actually real at the same time. Like it's the real fake stuff versus the fake stuff. I don't know. But yeah, there is a sense of at least there's something to react to. It's hard for actors to react to nothing. An imaginary thing.
Yeah, because I think all the things like watching the behind the scenes for like the Avengers,
All
or
the
all those
green and
things.
blue.
and like the Hulk is actually just a tennis ball.
Yeah, and they're like, oh,
That's exactly what they do.
just like that. I would do that.
They go,
I
and then movie magic, it's done.
movie magic.
So you have a new job.
I do.
You are no longer, you'll still be in the pharmacy,
Yeah,
but like
I'm
once a
technically
month.
still in there.
You'll
Yeah,
be the pharmacy's period.
yeah.
You just visit once a month to cause havoc
Yeah,
that lasts a week.
it can depends on how bad the pain is.
And then you're gone, and we're like, okay, we won't be back for another 3 weeks.
Has it really? Has it been better since I've been gone?
No.
I went in there a couple times, like not working, just to get boxes, and
It's been so crazy.
it was ridiculous. Like I went in there once, and they're like, "Are you here to work?" I'm like, "No, I'm just here to grab some boxes." They're like, "Oh."
I was supposed to be working somewhere else, and I went in, and it was so crazy. I stayed for a couple hours, and I'm like, "Sorry, guys, I gotta go. If I'm gonna be here till it's not crazy, like I'm never gonna leave, because it's gonna be crazy forever." Well, like recently in Utah, for those of our avid listeners
Yes.
outside of Utah, which means outside of our family, which means you don't exist. Utah has had a Hep A outbreak. And so when I was in there Wednesday, that was like when everyone started to panic. Health department saying, everyone get your vaccination. So we got tons of people coming in. And Hep A is not usually one that we vaccinate very often.
At all.
Like
even when we offer it, they're like, no.
Healthcare workers, people going out of the country, and people that handle food. But out of the people that handle food, nobody gets it. So pretty much, if you're working at a hospital or like pharmacy, but even then it's not like required or anything. But
No.
those are the only people that got it. So nobody carries a lot in stock. However, we have this outbreak, and now everybody is like indicated to get it. And so now you have a whole town of people trying to get it. We run out, and then everybody orders a ton from the suppliers, and then the suppliers go out. So I was like calling corporate and distributors and manufacturers and stuff like that, being like, hey, can you guys give us some more? And it worked. And they're giving us more.
Oh, so you are going to get more.
Head to your Springville Walmart.
And get
I don't really care. Head
your
to
Hep A.
any pharmacy or health
Hep A.
department.
Sounds like Hefe.
Hefe.
Get a Hefe shot.
Your HEPA? Not HIPAA, but HEPA.
Get a Hepa shot.
Yep. You get vaccinated because you got like 2 weeks after the exposure to get it. Or you can go in and get your immune globulin.
That sounds like a weird jelly.
Just the way it is.
Well, globulin.
Globulin.
I'm gonna get some toast and globulin.
I have to say that word really slow or I'll butcher it. Globulin.
I probably did butcher it, but
I don't care.
do you think it was like a ploy?
No, I was seriously thinking like this has been great for business.
Yeah, like seriously, they have a couple cases of Hep A, and then all of a sudden, it's like, they commercial about it, put it on the news, and then it's like, better go get it. Because you were saying that you guys did like, what, almost 100 shots or around 100 shots?
We did like 12 the first day, so we ordered 70 for the next day and did all 70.
Oh, that's ridiculous.
And then we ran out, and so now we ordered like 150 more in.
That is so
Plus
crazy.
some Twinrix, which has the Hep A and B. And so that'll be coming into, I think we ordered 50 of those, so.
I mean, if I was a corporate guy, I'd be like, you know what? We haven't been selling much of that. We need an event.
Yeah, going to the hospital. Oh, you have pneumonia. Can you cough into this jar for me? And then you put it in your like bacteria incubator, and then you swab it and put it into like a plastic spray bottle. And you fill it up with water, and you're just going to random places and like spraying little kids in the face. And they get pneumonia, and they make the news, and then everyone wants their pneumonia shot.
Oh, who was it? My brother-in-law was talking about a lady in his one of his classes. She used to work at like the reception desk at one of the U of U hospitals.
Mm-hmm.
Anyway, she was talking about some of the stuff that can go on there between doctors that are just kind of weird. Doctors can be kind of weird.
Yeah.
And how almost like incompetent some of them are. She was saying like she had to show someone like how it was like one of the smartest doctors there anyway, like how to like fold up a letter thing.
Mm.
Like I don't know how serious the guy was or the whole story, but from at least the way he told it, yeah, like the guy was just like totally incompetent when it comes to everyday stuff. Yeah, common sense and everyday kind of things, and it was just like weird. And I guess some doctors hate each other, and I guess there's been times where they'll throw scalpels at their assistants and stuff.
Those are sharp.
Yeah, it's like I don't know. Like, I mean, it makes sense because doctors are people too, so they have feelings.
Yeah, which I think is something that nobody like considers. Is they're
Right.
supposed to be the empathetic,
Yeah,
moral compass.
but at the same time,
they're
it's
just people.
I wonder how many of those, because medical field in general, like everyone's told to flock to because it's like, oh, there's jobs, and so it's like, how many of those doctors are actually wanting to be doctors, and how many
Yeah.
are there just because of the paycheck?
Mm-hmm.
And I'd like to know. That would be funny to find out, like which ones are the ones throwing scalpels.
Because like interviews for middle schools, they're like, so why do you want to be a doctor? And they go
Right.
off in the story, but it's like, oh, really? I want to specialize in this because then I get like $500,000 a year minimum.
Yeah,
That would be cool.
yeah. And anyway, it was just funny because like I guess she ended up quitting there because she's like it was just She had an emotional breakdown seeing too much of behind the scenes.
Well, I'm gonna just put this out there. There's a lot of stupid healthcare professionals.
Yes.
So not even doctors, just everybody.
Yes.
And that's why it's really important to look at like guidelines, because those are the smart ones that are putting out there. Those are the leaders in the field. But then you gotta also realize the guidelines are generalizations of everything. We're trying to fit everybody into a bell curve. And we got outliers out there. So you got to know like to follow guidelines, but then also know when to kind of skew from those.
Right.
And so
everyone's different.
Another thing though, because I don't know, I think healthcare is very tricky and people don't realize how tricky healthcare is. So you're coming into the doctor and he can only diagnose you as good as you tell him their symptoms are. And a lot of things you tell him the symptoms are follow 1,000 different diagnoses. Like,
they all start the same.
Yeah, it is really hard. Like, I don't know if you ever watch House or anything like that. I mean, he goes through a lot of different things trying to figure out what's wrong. He eventually gets it, but he doesn't get it his first shot, you know? But that's kind of just how medicine is. Like, I thought there was a lot more clarity in medicine than what there is. There are some things that's clear, like vaccines are good. Like, that's clear. But there's also a lot of things that, like, aren't clear.
Well, I actually read an article just recently. I guess a girl died in December. Anyway, I don't know if you read it. I guess she had the streptococcus, whatever bacteria in her blood.
Streptococcus,
yeah. Yeah, streptococcus. It was in her blood, and it ended up killing her. And the reason why, though, is the parents actually took her to I think an urgent care first. The first time she was showing symptoms of the flu and different things. And that's what the doctors thought. Like, oh, this is probably just flu. She just had the basic symptoms, no big deal. Sent her home, you know, gave her some medicine, called it good. Then all of a sudden, the parents were talking about, and they thought the same thing. The parents weren't even worried because they're like, she's had the flu for, 7 days before, but I guess she only had this for about 4 days. All of a sudden took a big dip, like in her, like just whole demeanor and everything. Then they took her to a hospital and they thought the same thing, that it was probably just a bad case of the flu. And then, once it got a certain point, it just took her real fast. And it wasn't until the autopsy kind of thing before the burial that they even found out that was the issue. And it was like, she'd went through 2 doctors, both, like you said, all the symptoms point to...
And it's hard if it's like during flu season.
Right.
And that's what like every patient comes in, you're like, oh, just another flu.
Yeah, it's easy to just... Well, especially when they all start the same. It's like runny nose, cough, sore throat. Yeah, that could be like everything from, the common cold to, you're going to die. It's like, how do you... And it was kind of nice because at least in the article, the parents weren't going to hold... her holding the doctors accountable or to the point where it's like they did what they thought and the parents thought the same thing. So it was interesting where they're, they were just, they're trying to figure out, what could they do better. And it's like, I don't know, in certain scenarios, it's like, what could you do better? I mean, you could try and run every person who comes in with a common cold through every test in the world, and then you would find out what it is. But it's like, to do that for every person, that's
the cost efficiency of it too.
That's like, is that really effective? So anyway, it's interesting, but it was, again, like the parents, that was interesting too, because they're like, yeah, she's had a cold for longer than the few days that she was having this. And so they thought the same thing. They're like, yeah, it sounds reasonable. She's been sick before and it's just gotten better, but it's just like,
what the people should know is it's to kind of follow your intuition too. Right. Like they tell that with parents too, but like if your mommy button goes or your mommy alarm goes off, like take them back in, like say, hey, this isn't normal. This isn't how my child normally acts. But you can do the same for you. I mean, you know how you're feeling. You're like, this doesn't feel like just an average cold, or this doesn't feel like
wrong.
This feels different.
Yeah.
Because I mean, doctors, I mean, they need to hear that in order to make a better diagnosis. I think sometimes they get stubborn because you get patients that think
hypochondriacs.
Because they went to like WebMD, like I know I have cancer. I can feel it.
We've worked with some people like that.
I'm looking at you right now, and you are giving me cancer through your brainwaves. I can feel it in my arms. True story. That happened.
Did someone told you that?
Yeah.
Who?
HIPAA.
Oh, never mind. You're right. We'll talk about this later.
It was just yeah, talk about it later.
Just kidding. That's how HIPAA works.
No, but I mean,
Kidding.
I was going to tell a story. My best friend, his mom died his senior year, but she had like a bunion removed on her foot, so very minor surgery. Was having some lung issues. It was kind of the symptoms of getting the flu or bronchitis or something. But she went to the doctor and, they told her just to rest and it'll pass. She ended up dying that night. She got up, had a hard time breathing and went down the stairs and collapsed. And I think he went down and gave her CPR and then she didn't make it. But that's the reason I'm not a physician.
Yeah.
And I'm a pharmacist. I wouldn't be able to deal with that. 'Cause like, I don't blame the doctor. I mean, it's something like a bunion removed. Like I would think that now, but that's because I had that experience and I'm like, oh man, because I've had patients come in and like, did you have any injuries in the last little bit if they come in complaining about stuff? But I mean, during flu season, it's just 99.9% of the people come in, they say that, and you wouldn't really put those together, but that's what happened. And so I don't know, that'd be hard to live with. I couldn't do it.
Yeah, there is that fine line with that doctor profession where, they do get paid a lot, but they do have a lot of liability and stuff, and with all the legal stuff attached to their profession or with the medical field in general, it's really hard to make those professional judgments that typically doctors and pharmacists are supposed to be able to make. Mm-hmm. But it's like as soon as they make one under that underlying of this is a professional, decision, it's like they've got so many litigation things that will, ask them why you should have done, did you follow, all this stuff.
Also
it's
regulations. They're
right.
regulated by laws and they're regulated by insurance companies. I mean, a lot of the laws are like there for good reasons, but I mean, they have patient surveys that they have to do. And if the patient survey is how adequately to treat your pain, but at the same time, they got to make sure they're not, contributing to the opioid crisis.
Right.
And it's just tough to be a healthcare professional right now.
Right. And we put a lot of, responsibility on them and almost tie their hands in a lot of ways. Mm-hmm. It feels like where it's like, if they do something wrong, it's like first thing is like sue the doctor. Yes, there's situations where, they probably were doing some like negligence and all that stuff. Mm-hmm. But for the ones that aren't negligent, they can't do what they feel they should do because of, the legal ramifications of doing something outside of, standard practices or whatever for certain things. Where it's like a guy may look at something and be like, I know this is what we should probably do, but I have to go through these steps before I can even attempt to do what I think we should probably do. Mm-hmm. And I don't know, kind of gets in the way of stuff. Anyway.
Or being able to say what you want to say.
Right.
Like, I feel like doctors are shamed and there's this whole like fat shaming and all this other stuff like that. But doctors should be able to say, hey, your weight's not a healthy weight. And they're like, well, I'm told to respect my body and to own who I am. And da-da-da. And it's like,
and love me for what I am. It's like, this is it. It's like, you got to fix it or it's going to go.
It's like, well, I mean, yeah. Because we talked about this last time with Dallin. But there's times too when like somebody comes in and they're getting syringes, and they're sweating.
You're like,
and they're going through withdrawals.
What
and you know what they're using those syringes for? Like, I don't care if they get syringes. I mean, I do care. I want them to get their syringes. So I don't care what they're using it for. I want them to get those syringes. I want them to be clean. Like, last thing I want is to spread diseases and cause, that one young child, the first time using, they get HIV. I don't know.
It's true.
Stuff
it's like, which
that
is worse?
Makes me mad. I'd rather them get high safely than unsafely. But I would still like to be able to be like, so I know what you're using this for. I'm not stupid. You don't have diabetes type A, because that doesn't exist. And be able to talk to him and be like, hey, just so you know, like, these are resources we have. If you ever want to get clean, like, I'm a resource. We can help you out. Like, I don't know, being able to have those open, intimate conversations. But I feel like with the way society is, if you were
Quick
to
to
say
be
that
offended.
to anybody, yeah, you're quick to be offended. Like,
how dare you accuse me of such a lifestyle? It's like, I just,
I'm just trying to help, and it's
Yeah.
obvious that you're not using it correctly. And
Like,
if you
we
are,
do not have an
just
18
be like,
gauge insulin needle.
this guy, yeah, yeah.
They do not work intravenously.
I need a 100 ml. You're like 100 ml. That's a lot. You should not do that much heroin, sir. Like, you're gonna die.
That's a big problem.
But yeah, 'cause I mean, it's like obvious with some people, right?
Yeah.
Or they like pick up their phone and
it's
their
for my
phone is still like
grandma.
the screen's turned off.
Let's-
Yeah, grandma. Yeah, my grandma said she needs it.
The biggest needle you got. She likes the big ones.
Do you have the longs?
Yeah, the long ones. It's
Like if somebody came in and was like, "Hey, I want to do heroin. Just get me any syringes that will help me get my heroin in." I'm like, "All right." I go grab them some syringes. Any syringes, because you can get it in no matter what. But then you can also have that little talk with them,
yeah.
like you would if somebody smoked. You know, you talk to them about how to quit smoking, and you can do the redness ruler on them. So when people are wanting to smoke, you're like,
Redness
so
ruler?
on a scale from 0, as in no desire to quit smoking, you're gonna smoke till you die, and a 10 meaning you're ready right now to quit smoking. Where are you at? And then they say a number like, 3. Oh, you're a 3. That means you're not a 0. So you must see some benefit in quitting. What are those benefits? And then they start saying it, and they're like, oh, wait, well, what would it take to get you to a 5? And you're just using that as a motivational tool, but using that on someone with like heroin.
That would be interesting. How high do you want to be? Not
How much do you want to get this? He's
Yeah.
like, right now, I'm a 0. Like, I need to get high, but then maybe like an hour or two, then ask me, and I'll be like maybe a 1. And then maybe in a day, I'll be like a 10. And then go straight back to a 0, just because that's unfortunately how addiction works.
Yeah, and they're like, I don't know what to do. Yeah. That would be funny.
Yeah, healthcare it's a mess.
It is a mess. Well, and it's, I don't know. Again, I don't know where to go with a lot of it. I guess in one case too, there was another one of that lady's stories. There was like a high profile doctor student person or whatever, and he did something wrong, and like the board was trying to figure out how to, like, instead of own up to it, they were like trying to figure out how to cover it up. I'm like, I wonder how many times that happens.
I think most boards are pretty lenient with what you can get away with. Like, what's a good example? Oh, so like pharmacy. Let's say you get addicted to narcotics or something like that, and you start stealing from a pharmacy.
Okay.
Like, you're not going to lose your license for it. They're going to send you to like rehab, and they're going to get you treated for it because it is a disease. And then you can go back to working. It might be hard to find a job
Because everyone's
afterwards.
like, I stole from the last pharmacy I worked at.
Because they might like suspend your
Oh.
license until you get out of rehab. And so, I mean, it'll be on there. And so anybody that goes to hire it, I mean, they're going to see it. But
So you have to find an independent pharmacy that's like, you know what? We don't care what happens.
yeah, start your own.
We'll just give
or-
you, we'll order a bottle for you, a bottle for the customer, a bottle for you. Just kidding. You
But I
wouldn't do
mean,
that.
there's quite a bit you can do. And I don't know. You always see these errors that happen, like medication errors that horrifies me. And part of my job is to try to get everyone trained and following procedures so that doesn't happen. Because I don't think anybody wants to. I think some people want to.
Follow
Remember how we talked
procedure?
about I was going to take like pneumonia, put it in a bottle, and start spraying little kids?
You gonna spray people in the pharmacy?
I don't think most people would do that, like to get money and stuff like that. I think the people that do that are just sick.
Yeah.
Like, I remember seeing a news report of a guy that had HIV, and he was drawing his blood,
And just
and he goes to a
making a
grocery
mess.
store, and he would inject it into like a banana, and so you wouldn't see it unless you opened up the banana.
Ew.
And I saw a picture of it. I'm like, well, I can never eat bananas again. But like things like that, that's just
That's gross.
It's messed up.
Well, and if you ate the banana though, would ingesting the blood would give you AIDS?
I think so. Let's say you had like a sore.
Yeah,
or a cut in your mouth
but
or
you'd
something
have
like
to
that.
have that though. It doesn't have to come in through an open wound, or could it go through the digestive system and actually still?
Well, I think you'd absorb some through your. I don't know. That's a good question.
Because I've always heard that. Yeah,
I'm supposed to
when
be
it comes
like
to AIDS, it had
The
to
one that knows
be.
this stuff, but I don't.
Well, because that's what I've always heard, where it had to be. It's almost like an open
Like
sore.
blood.
Yeah, blood kind
You
of.
get it through sexual.
But there's
juices
blood
and stuff.
junk in that.
Oh, blood.
You know what's weird is anyway. I always
I
thought
was
it
gonna
was
make a really inappropriate comment about a way that you can get blood, but it would have been maybe not a good thing to say.
But it's not. Well, even with that though,
Lesbians on their period is where I was going with that.
Oh, that's just mess. Yeah, that would be blood for sure.
But that was the only thing I could think of, unless there's like an accident.
But isn't it? I don't know. Anyway, isn't there like? But even with that, there's not 100% guarantee that it would pass.
So like, let's say you get stuck with it. I think it's like 1 in 300 chance that you would actually get HIV
from like intercourse kind of stuff.
From intercourse, I'm not sure.
Yeah, that's what I was wondering.
So yeah, it's not even 100% still, but
yeah, because from what I heard, like as you move down the chain, there's more and more chance of it. But anyway,
yeah, if we were more professional, I would just Google, and while
if
you
we
were
were
talking, I would
professional,
like search it and be like, "Can
it's
you
more
get
fun
HIV
to wander in our
from
minds?"
eating it?"
Yeah,
I bet you could.
I think you could, but the chance, like,
I think
again,
it's less than if like you took that banana and rubbed it on your
on an open
scab.
sore. Yeah, it's like, ugh. Or if you had like canker sores in your mouth and you're like chewing on a bloody banana, that just sounds gross.
So Maalox, lidocaine,
And
and oral
Benadryl.
Benadryl. If you have canker sores, swish that in your mouth. If you don't have access, you can just swish the other two and then put like Oragel on the spot.
Can you put
Same stuff.
Oragel in the mix? No.
It'd be hard to, I think.
To squish it out of the tube.
And you'd have to put a lot in.
Can you buy lidocaine? I know there's a lot of new pain things that are actually putting it
Not
in
an
there.
oral. There's lidocaine cream and aspirin,
Yeah.
and there's like
I wouldn't-
lidocaine
I
and like
wouldn't put
burn
that.
relief gels.
But they don't have lidocaine like just as a
Yeah.
like the viscous solution.
Dude, but that stuff rocks. Like, I had what was it called? An ulcer on the back. Like, that,
In your face?
what is it called? The thing that dangles in the back of your throat.
You had an ulcer on that thing?
Yeah, it had
a
an
gobbler?
ulcer on it, yeah.
I don't know what it's called.
It's like uvula.
Oh, that sounds right.
Ovula. I don't know. That thing that you're always worried about swallowing when you're a little kid.
So what is it?
I always thought I would swallow it and it would fall off.
Oh no.
And then also reminds me, I think it's on Fievel Goes West.
Yeah, where he's
where
holding on to it.
He holds on to it too, and
Yeah.
I'm like, ugh.
Yeah,
Every time I see that, it makes you cringe.
it does. Especially when the way he starts talking. It's like,
Yeah.
yeah, he's like getting all like airy, trying to talk while Fievel's hanging on that dangly thing. In his
Meanwhile, I
throat.
got lidocaine for that, and so I've made my own canker sore thing because I don't get cold sores. I get canker sores. What about you? Cankers or cold sores?
I get cankers.
I think it's a better way to go.
Yeah, because the
'Cause it
cold
hurts,
sores are on
and
the
then they can
outside and they
maybe-
crack and get messy.
More
'Cause
irritating, and maybe hurt
the canker
more,
or
but you
the
don't
cold
look
sore?
like you have a nasty
Yeah,
herpes
like
on your lip.
yeah. Well, my sister and my dad, they would get cold sores, and they would. It looked like a really bad dry spot, and it would crack, and it was hard for them to still like talk and stuff. You get that way. Anyway,
I think it makes people look like meth heads. You know, when they get the sores on their face. Whenever I see it, that's the first thing I think of.
like, oh, you're meth, or you got herpes,
I was like, this is the after.
or you got a cold sore.
When it shows like the transition, there's like normal, 1 month of meth, 2 years of meth. Like they show you that transition. I'm like, you're in the 1 month stage. You just got your first sore.
Congratulations.
There's some of those though, and I've talked about this in pharmacy school. We actually went on a site where it showed a lot of them. Some people look pretty good after some meth.
Like better or
They lose a little bit of weight. They look healthier. I mean, the 2 year thing, they all look worse. But there's some people who are like, oh, look, she Did her hair all different. She's lost
thinned
some
out.
weight. Maybe a couple sores, but that guy, yeah, he looks like he's been hitting the gym or he's actually just been doing
He's all
math.
ripped. Yeah. It's like
But I think most of them don't smiling with their teeth.
0.5% body fat.
Yeah.
And that's why you can see all the muscle.
But then they smile and they only have one tooth left. And you're like, okay, maybe
It's not worth it.
not worth.
Did you see that tooth?
You can get dentures.
It's not worth it, man. I watch those dental commercials for dentures where it's like, look, it doesn't fly out of your face when when you're trying to blow bubble gum or something.
There's that
dumb.
video of the grandma that she's blowing out her candles and she spits out her dentures.
Did you see the one that was skydiving and her dentures like fly out?
It'd be cool is if she like found it and like dove towards it
Yeah,
and like catches it midair.
and then smiles at the camera.
It's like, yeah, but they're upside down.
That would look weird. Have you noticed like Tom Cruise, like his tooth, he like one tooth. You know how you have a split, like a tooth on each side. And it's like like the line in the middle.
Your
His tooth is
incisors?
like but his tooth is like in the middle. It like lines up with the middle of his face. It looks really weird.
I'm actually gonna Google this.
Look it up because Tom
forget
Cruise has a
Telling
tooth
anybody about
that lines up with
HIV,
the
I
middle of
want
his
to know
face.
about Tom Cruise's. Wait, I just got distracted.
Yeah, what'd you read? Oh, back to the
It says
intuition thing.
all-around provocateur. Russell Brand says Christ teaching the relevant, and then it stops going.
Well, that's
But
the
I'm
end
not
of that
gonna read it.
article.
I actually like Russell Brand though.
Oh,
Listen to talk. He's
I don't
got
know
some
who
good
that
thoughts
guy
in his
is.
brain.
yeah.
He's on the Joe Rogan show a couple
Joey
times,
Rogan.
but he's been on a lot of things advocating. Like he talks about treating drug addicts.
We're
like-
gonna have
like
Joe Rogan
patients.
on our show.
Oh yeah, Joe Rogan. If you want to be on our show, we'll just shut up and let you talk for the whole thing.
And we'll just go.
We'll just ask you some questions. Like, yeah, uh-huh.
Yeah,
Yeah, you're right, Joe Rogan.
that's right.
All right, Tom
We'll call you out
Cruise
to
teeth.
get a hold of us. Facebook, Twitter, Instagram, and YouTube.
So my little brother, you know, he said he has one tooth that's like longer on the bottom than the other ones,
Okay.
so he can kind of move his lip down, so he can't see any of their teeth, just the one
Yeah, so it
tooth
looks
that's
like
popping up. And he's like, and he like does a crazy voice. It makes me laugh every time. He can do that, and then he can flip me off with his toes. He can lift his middle toe and then flip you off. In fact,
But is that
I should
still
text him and
flipping
ask
off?
him to flip me off.
Just send a picture.
And send a
we'll-
picture
we'll
of his
put
crazy
it on our-
tooth.
put it on our.
So I just picked.
We should do
did a video or
an
pictures of Tom
Instagram
Cruise.
video of it so we can post
Yeah.
it, share it.
I'll share it and make
It's like,
Jason,
check
you're
it out.
famous with
We'll
all.
tag it
Oh, that guy has missed it.
with all 3 views.
So on Tom Cruise, he only smiles showing his upper teeth.
Right, but have you noticed? Look at that. It lines up perfect with his face. Like right down the middle. He has one tooth that just lines up everything. Like you look straight down the
Oh,
middle.
you
of his
said it's
face.
the top teeth?
Yeah, top teeth.
Okay.
Sorry. Yeah, it's the top teeth.
I can see his nose kind of crooks to his right, and his teeth are kind of shifted to the left.
Yeah, isn't it weird? Like his teeth are shifted.
Oh, I actually have a picture, and they draw a line down his face.
Oh, someone see, it's not
Yeah,
just me.
yeah.
I knew it. It is
I wish people could see what we're seeing, but
Yeah,
it's
isn't
funny
it
you said
weird?
that. I never noticed.
Well, I never noticed for the longest time until I think it was, I don't know which show I was watching. I was just looking. I was like, how come his teeth look like they're off?
So my wife's missing one for lateral incisors. So it's like not your 2 front teeth, but the one next to it.
Okay.
She's missing one. So she's missing whole tooth. Like it just never grew in, and all her teeth are lined up perfect to that. But she's missing one, and they didn't realize till she was like 17. They're like the hygienist. It wasn't even the
Really?
dentist that they were counting the teeth. She's like, "You're missing a tooth," and she's like, "What?" Never noticed. And that's when I stopped loving her. Just kidding. I was like, you monster.
It's like, how could you not tell me this all our lives?
You don't even have all your teeth.
We've been friends forever.
You're disgusting. No, I don't even know, so I don't care.
You just told me. Of course you know.
So everything I say is just
It's
I have
just
a hard
that.
time being serious with anything. I think it's a defense mechanism.
It probably is.
Because when I would get yelled at when I was a little kid, I had a bad habit of laughing. So they would be yelling at me and I would be like laughing. It doesn't make them happy. My mom called me a son of a bitch once. And that made me laugh.
John, you.
But that one had good reason to laugh. Yeah.
Well, anyone who's says that at you, like to a kid when you're
especially your own son.
yeah, like the person is like, you're like, I am.
Yeah.
That changes things,
I was
doesn't
like,
it?
is that even an insult to me?
Or
That's kind of
you,
weird that that's an
yeah.
insult. I guess if people really are caring for their mom, it's like, oh, what did you call my mom?
A female
But
dog.
nobody takes it like that. They're all like, what?
No, it's like a badge of honor. It's like, yeah, I am. What you can do about it?
See, I'm not as privileged as you are. Some shame. I don't know.
Oh, maybe you could flip it. Maybe they are privileged, more privileged because they're that.
Maybe, yeah. You have your mom's a biatch privilege.
That's right.
You don't even know what it's like not to have a mom be a biatch.
Yeah, so it's like you go do your posh.
You better check yourself.
Yeah. That's how it goes. So back with the
What were we talking about? We were talking
I
about
don't know.
this all started with the Hep A outbreak.
Yeah. Oh, back with the intuition thing when that one lady died or whatever. Anyway, but you were talking about like, follow your own kind of
Yeah. So like
mommy
you have
intuition
your
thing. That happened just
mommy
recently.
alert that goes off.
Our son just actually over this weekend, it was kind of a crappy weekend. Like he woke up Saturday morning and he was just ornery, more than usual. And he seemed like he had some kind of pain, probably in his ear, but he was grabbing around just the side of his face. Anyway, and we asked him because he was just so, ornery and just, you could tell he was just, yeah. And we're like, so do you hurt? And he said, yes. I was like, where? And he's pointed to his ear and just down his jaw a little bit. And I was like, oh, he's probably got an infection. But it was crazy because he didn't have a fever. He didn't do anything really outside of typical except for the fact that he was more irritable and he was just so not normal again, where it's like he's a crazy boy already. So, but it was a different type of crazy where it was like, yeah, he was irritable and he was just, extra cranky and stuff. And we're like, and it had lasted like, even the day before he was cranky like this. So today or Saturday was just the point where I think it had gotten to where it was on a consistent level. Because before it was like kind of off and on with his cranking. We're like, oh, he's probably just in his terrible twos, all that kind of stuff. But then Saturday was just like, no, like it was consistent now. Like it wasn't just off and on. And I think he's got a crazy pain threshold because he's one that will, run his head into a wall and we're like, oh man, are you okay? That sounded like it hurt. And he'd be like, what? Nothing's wrong. And he had like this huge bruise. It's like, dude, do you have like a concussion? And he's like, no, I'm fine. It's like, yeah, we always worry about him. Like when he gets older, he'll come in like missing an arm and be like, hey, can I have like $5? I want to go to a movie. I'm like, dude, you're missing your arm. Oh yeah, that was a little thing. That's no big deal.
It's like Monty Python.
Something's wrong with it. Yeah, it's like, oh no, that's okay. It's like, no, the guys want to go do something else. I'm like, oh no, you're crazy. But anyway, we ended up taking him to the doctor. We didn't really want to because we were doing a bunch of other stuff. We're like, oh, we better do it because
we were too busy.
Well, yeah, you get caught up with stuff. Anyway,
kids are so inconvenient.
Yeah, so a lot of times. Anyway, not that kids are bad; they're just inconvenient. Inconvenient doesn't necessarily mean bad.
Because you'd be like, I want to go to bed right now. And your kids are like, it ain't happening.
Yeah. Right. Anyway, but we ended up taking him to the doctor and they checked him. They're like, yeah, he didn't have a fever, but my wife was the one that took him, and she said as soon as the doctor just looked in the one ear, he's like, "Oh yeah, that's it." She just like there was no question about it. Like it was just like a simple like look in there. Yep, that's
see this
exactly
blood dripping out of his ear.
Yeah, he's
no
he's
good.
dying. No, but yeah, so it was pretty quick, and we were happy we took him in, but it was just that idea of like he was, off his typical crazy. So
yeah, we had the same thing with Zoe because Zoe's crazier than our first kid.
Yeah,
and she's a lot more emotional, but she had a stretch where she was super emotional. We're like, this isn't right. So we take her to a doctor. We took her to her a couple times, and we just kept being like, nah, something's not good. So they finally did like a whole blood workup, and I guess she was super anemic because she had been drinking lots of milk. And so if you have too much calcium and stuff like that, it lowers your acidity, and then you don't absorb as much iron. So yeah, she was low on her iron, but so yeah, now we've been giving her iron drops, and she's a lot better.
So if you have too much
iron
calcium,
drops are just good. Yeah, drink too much milk, it can happen. And if you do it too much, like one way you can tell too is if they have like almost white poop as well.
White poop?
She had a couple that were like that.
An albino turd.
Kind of. It's almost like a white gray. Let's see. I'm trying to think of a color that goes with it, but like almost like the color, that like grayish stuff that's around like when you hard boil an egg. It's around that yolk.
Oh. So it's
almost like that, but a little bit lighter.
So it's like a pale poop.
Yeah, it's really pale. So it's like whitish, gray, and green.
Okay. So green poop means you're iron deficient?
Not green.
Anyway, I've had different colored poops. I've had this conversation.
So, I don't know if you do this too, but if I have a different colored one, I Google it like every time. So
I try to Google them, but I never seem to find the right answers or any answers. But I've had some
there's tons of good websites.
I've had some that almost look tie-dye. Is that a problem?
Tie-dye would probably be bad.
Well, not like super
unless you're
tie-dye.
eating
It's like
pure Play-Doh.
2 or 3. That's what it looked like. One time I was like, maybe it was after all the Fruit Loops or Fruity Pebbles.
I don't think this is normal, Stefan. Remember you said like back in the day you weren't absorbing protein or utilizing it in your body?
Oh, that could have been.
Maybe this is related.
Oh, it could be.
Because I would think tie-dye poop is...
Well, it was like, you know how you're talking about there's like the green and there's like an orange? And it was like...
But it's all blended together. It's not like...
But it wasn't like a solid blend.
Log is...
No, it was half. It was like that was the thing.
That's the part that's not normal.
But what is normal when it comes to poop? There's so many different...
normal would be...
just brown and stinky.
We talk about poop too much on this show.
We're going to change the name.
So it's
Poop
not
dog.
loose and it's not too hard. So it's a soft but firm consistency. That is normal.
Okay.
Normal would be a dark brown color.
Does that have to be dark brown? Are we racist? It can't be light brown?
No, it's opposite of racist. Because you can't be racist against white poop.
Oh, that's true.
Because there's no such thing against racist against white.
You
can't
got a
do
point.
that.
Yeah, that's you do got a point there.
But yeah, that's normal. Because like anything that diverges from that, it takes away. Like it all has a problem. It's with it. So if it's loose, or if it's too hard, it's the speed it goes through the tract. And
what happened to me?
I don't know.
Lately,
man.
my poop's been pretty normal.
Man.
So maybe there was.
So it was just something in the past.
I wonder if it's something with
got
stress. Stress can hurt your digestive system, can it?
Stress hurts everything.
Pretty much. Okay, that
Body
sounds
releases
right.
like.
Because I wonder if those were probably the times that my poop's been the weirdest, or the times where it's like stressed out with school or something or whatever, just different things. And I think the times I'm the most stressed, I get the strangest turds.
That's got to be like the best but worst job. Like all
poo
you
analyzer?
do is colonoscopies.
I wouldn't
talk
want
to
to
people
do.
about their poop.
I wouldn't want to do a colonoscopy.
But
I wouldn't
you get
mind being
paid so well, and it would be so easy. That's got to be the easiest field, is just doing colonoscopies.
too many apples.
Like, oh, you got polyps. You got an inflamed colon.
See, I wouldn't want to be the colon guy. See, I would like to be a poop forensics person.
Not me. I can't even change baby diaper poop.
No, but
like,
you'd
no
have
way
it.
could
You'd
I
have it
take
in like
somebody's nasty
what
C
is it?
diff.
What do they call it? A flow hood or something? Where it's like it's in
The
like
fume hood?
no, it's like it's contained in a box, and you have like those gloves that are like go through the thing, and you just see that way you can just look at it, and you don't have to smell it. Because isn't it the smell that makes you gag? Like if it doesn't start,
I think it's
smelling,
just the thought of it. Like
just the thought of poop.
Yeah, if I think about it too hard, like I start gagging.
Well, then you're never gonna be even a rectal guy. Because I mean, what if someone?
I'm not a rectal guy. Yeah, not my thing.
Right.
Not for me.
Doctor, rectal. No.
Is it proctologist?
I have no. I don't know.
When I get on the pod, it's also late. I'm tired.
It is late.
You know what's crazy? We're like talking about how late it is. It's like 9:40.
That's late, man.
This is like sad. It's sad getting old.
Yeah.
I used to be young.
Yeah.
Never hip. But I was young once. Now I'm an old man. Things are falling apart. I get tired. Sometimes I'm like, what time is it? And you're like, oh, it's only 7. I could probably still fall asleep. Now we talk about it. Now you have to yawn.
I know. Stop that.
Okay, let's talk about having so much energy. I did crack
that was
once,
quick.
and I had so much energy. No, I've actually never done crack. I can say that with all honesty.
Rectal surgeons have. Just kidding. That was a bad joke.
Done crack? It sounds like a lawsuit.
Yep, it was. I don't know. Well, I think that probably concludes our evening for tonight.
Yeah, we could. That's a good finishing note.
I think that was a good.
We had a good discussion on poop. I feel like we got to talk about something else besides poop. One of these times.
Well, it's not every time. I think this is the first time in a while.
We're gonna get.
We've made several
That's
podcasts.
true. We've done pretty good.
When did we talk about poo last? I don't know. It's been a while. Anyway, on that note, we hope you all are regular and become regular viewers as well.
I did get sick. Maybe that'll be a cool story for the podcast.
If it does that have to do with poo?
No.
Oh,
no.
okay.
My bowels were fine the whole time.
That's good.
It's when remember you had the headache and the vomiting thing. We were talking about it because you had it and I had it like around the same time.
Oh yeah.
So I had to teach this like 5-hour class, and it was like me getting evaluated, and they passed me off whether I can do it or not. And I got sick at the beginning of it. And so the whole entire time I'm like doing that thing where you're like swallowing, like trying not to throw up. And so I'm doing the whole thing. I get through like 5 hours. We'd take a break and I'd already run to the bathroom. And as soon as I got out of like the hot room and like cooled down, I'm like, okay, I'm starting to feel better. Got some air, then I go back in. We get to the point, like the end of the 5 hours, I had it. And so everyone leaves and I'm now getting evaluated. And the market director's talking to me and I'm like, I'm going to puke. And I turn around and run to the bathroom. And I didn't make it the whole way. I had to like do that thing where you cup your hands.
Oh.
And it's like coming in your hands and you're trying not to like push and get the rest out of your stomach. So I did that. So I carried it to the bath, like the bathroom and into the stall. So I drop it out of my hands into the bath or the toilet. Why can't I say toilet?
I don't know.
I keep saying bath. I don't puke in bathtubs, guys. But anyway, so I go into the toilet and I unleash everything, but it had gotten all over me. So I was like cleaning up in the sink. And this is at like a Walmart bathroom. And so it was pretty gross. But I still had to go back and finish my evaluation and get certified. I don't want to do the 5-hour thing again. So I went back and I probably stinked really bad. But it's only my reputation.
He will remember you
cares?
forever. He'll be like, there was that one guy that threw up.
Yeah, they're like, why don't you just like have somebody else finish it off for you and you go home? And I was like, because I don't call in sick. I just don't. Still won't. If I had a puke during the SOP class, I would have left puke. And even if I had puke on me, I'd finish that class. It's just the way I am.
What if you had a kidney stone?
I would miss half my shift because my wife would make me. And she only did it because I was all hopped up on drugs at the time because they gave me painkillers. Which I've never wanted painkillers as bad as I did when I had kidney stones. That was horrible.
Everyone I've heard with that has said the same thing.
Yeah, and then I was driving home from the SOP class, and I had to pull off the freeway, and I went into some guy's parking lot, some business, and I at least went to like the curb and like the outskirts of the parking lot, but I just opened my car door and it was violent. Like it's throwing up as a kid was easy, just like bleh, and then you're done. But now as a grown up, you're like bleh, and then you like your stomach's
Dry
still
heat
pushing,
forever.
but you can't do anything else. You're like forever, and you're like, am I ever gonna breathe again?
Right. And it's horrible when chunks of whatever go up your nose.
Yeah, that's the worst.
That was horrible.
We should
That
invent a
happened to me.
product that stops that when like going to puke. You could like put a block up there that blocks it.
But puking's kind of like spontaneous. If you have time to stuff something up your freaking nose,
I just gotta work out the details.
maybe it's an automatic thing that just goes boop as soon as something triggers.
Or start having like an IV bag plugged into at all times, and at any time you could put a drug in there. Because that'd be cool. Because when I was throwing up with my kidney stones because of the pain, they gave me Zofran to the IV, and it worked like instantly, and it was awesome. And they gave me hydromorphone to the IV.
That was awesome.
And it was awesome. Like it wasn't like awesome, like, oh yeah, I want more of that. It was just like, oh
I'm
yes,
relieved.
my balls don't hurt anymore. Because that's where it hurt the most. Like I felt a little bit in my back, but the main pain was in my right testicle, and it just felt like it was going to explode. Because I wasn't sure. Like when I went to the ER, I told the doctors like, well, it started my right testicle, and I peed, and it started on my back. So I'm like, oh, it's probably kidney stones, but I also kind of feel like my ball's gonna explode. Like this is bad. And that's when I threw my junk into his hands because he was being too slow, and I needed my pain pills. So I was like, just fill it. He's like, yep, probably a kidney stone. Let's get you some pain pills and then let's go take a scan. I was really dramatic. I had to like give him my ID and my insurance card.
Just give him your wallet.
I just threw my wallet and hit him in the chest, and I laid my head down. I'm like, oh, because I was in so much pain. Because I waited too long. That's kind of what I do. Like when I had pneumonia, my wife made me go. This time I actually woke up my wife. I'm like, hey, I think I have kidney stones. I gotta go to the hospital. Which I'm not gonna do that again. I have some Percocet left over. I have that saved. So if which is bad, I'm a pharmacist.
Yeah, it's expired.
Even if it's expired, I'm still gonna have that on hand so it can get me until I can make a regular appointment. Like, hey, can you just like give me one of those filters to pee in? And this time I'll go get my stone analyzed, and so I know what the heck caused it. Because when they told me, and I was just like grateful not to be throwing up and in pain.
They're like, do you want to frame this? It's like, no.
They're like, you can take this to a specialist, and I'm already like, oh, this is gonna cost so much. But I was like, if you took that stone to a specialist, they could tell you like what you're eating or what you can change in your diet to prevent it from happening again. And so next time I get kidney stones, I'll be like, why didn't I? Yeah, I was dramatic this whole time when the doctor told me too. He was like, so you have a small, it's just one stone. It's like blah, blah, blah millimeters. And I'm like, it doesn't feel like that in me. My testicle's going to explode.
It feels like I'm shooting out of.
And it's like he had to say that because I was so dramatic.
Right.
And I'm usually not dramatic about being sick. I'm ashamed.
It shouldn't be.
It's bad.
That's like, they say that's like one of the worst things a guy can feel.
Mm-hmm.
So, you felt it.
Yeah. I wish I could feel what childbirth feels like.
Why? It's
Just
gross.
You just
want to... it's just so gross.
Because then nobody can have that on me.
Oh, and say, oh, you did.
I was like, oh, yeah? Well, actually...
Well, just do one of the simulators. Would that count?
Because I feel like... I don't know. Men and women kidney stones, maybe they're different. I don't know. Probably not, because they're not like... They're up in the system, so they're in like the ureters and stuff, so... Maybe it is similar. But I think it would be cool still to like experience what it would feel like, because they have those things where they put those like muscle shockers.
Yeah, the simulation things.
Yeah.
I've seen videos of guys that are like hooked up and getting zapped to the pain thresholds of whatever a woman typically feels.
Mm-hmm.
But
So I wouldn't want to feel that, but I feel like a lot of these contractions are in your uterus, and we don't have a uterus,
yeah, so it's hard to
so
tell.
it's not the same.
No, it's just contracting the muscles.
So someday, if technology's there, I'm gonna get a uterus, have a baby, give birth to that baby, and then get my penis back.
Reverse engineer it all.
You know, hyenas,
just so you could say
they have the babies through their penis, and a lot of them die giving birth because it's.
a hyena.
I think it's hyenas. I'm gonna Google this. This is another Google worthy.
Well, I know what was it? The seahorse. The guy has the.
Yeah, the guy like carries the baby.
Yeah, he carries it.
And then he squirts out the eggs. I don't know how seahorses do it. Hyena baby. Oh, hyena birth.
Well, don't watch it.
Well, I don't want to watch it because I can only imagine, like, you know how they have those things where they had a cigar and then it blows up,
Mm-hmm.
and then you just see like the cigar. It's like cut in all these different ways, and they're all curled up around it. Like
That's how you imagine birth with a hyena. It's very possible.
Okay, so it's not the males. So it's males take no part in raising the young. Giving birth is difficult for female hyenas, as the females give birth through a narrow clitoris. And spotted hyena cubs are the largest carnivore youth relative to their mother's weight.
And they're not extinct. Explain that.
I know that's the crazy thing, because that you think would be something that kills off a species.
It's like, I ain't doing nothing with that anymore. Anyway.
So it's kind of like giving birth through a penis.
Or just dying.
I don't know how we got. Oh, we talking about kidney stones. That's why.
Kidney stones lead to.
But we were wrapping up talking about poop, and I was like, I don't want that to be the last thing.
Well, we'll stick with kidney stones and
So we're gonna
and
end on hyenas
birth.
giving birth through their narrow clitoris,
All right.
kind of like a penis. That's actually, I'm satisfied with that ending.
All right. Be sure to follow us on Facebook, Twitter, Instagram, and YouTube. And
Yeah, now we're on the YouTube.
I don't think we're gonna put pictures of some of those things we talked about. But if they pop up, you'll know you heard it from us.
Last story is U-Tube is an adult site, and we had a teacher that was trying to pull up a video on YouTube, and they put U-Tube, and it's like a lady that was naked, and underneath it said like 18 years and older, enter here, and to the right it's like exit here if you're not. And she's looking at it, and it's on the projector. It's like our first day of pharmacy school. And she's like, well, this doesn't look right. And everyone's like, click the exit button. You're supposed to do just youtube.com. And like, it was the first day, so nobody like ran up and changed it for her. She's like, what do I do? And like, she just stood there. It was like up there for like 5 minutes.
How old was this lady? She totally like technology illiterate.
Yeah. So I think maybe you talked about the doctors.
Yeah.
Need somebody to fold
No
their papers. Yeah, I mean she's a really smart person.
Yeah.
But she doesn't like her hobbies are like cycling and stuff like that. So
technology
how often she's on the internet is probably very slim. And obviously she's not an avid porn watcher.
Yeah.
Because
she didn't even know where she was.
She didn't gain those skills of hurrying and exiting out of the browser when that happened, or doing like Alt F4. Something like that to exit out real quick.
Yeah, without touching anything.
But yeah, that was pretty funny because everyone was chuckling to themselves, and you can see people like with their heads down, like, oh no,
right.
4 years of this.
They're all gonna wonder what's wrong.
So we are at youtube.com.
youtube.com.
YOU.
The one owned by Google.
.com.
Right.
So you just search chit chat that, and we'll be there. We
That's
got like
right.
a couple videos up.
CCT.
If you want to see my kids, there's
Yep,
a
we got
couple of
some.
them up there.
Yeah,
Being
we got
cute.
some videos. Oh yeah.
I try to get them to say, "Welcome to Chit Chat That with John and Stefan," and she won't do it because she thinks it's funny not to do it. But I think it's funny too, so I encourage her sporadic behavior.
Oh, there you go. That's fine.
I'd rather her be funny than anything else. Because if people like being around her, that's
good.
better than most things I can imagine for her. So
Well, cool.
that's a much better way to end the segment.
Yeah, it is. All right.
Hyena, narrow clitoris. That's how they give birth.
And I'm Stefan.
And I'm John. Chit Chat That.